Coming next, so that is a female presented with history of car accident. She has extravasation of urine. Now she has actually the extravasation of urine. The internal iliac artery was ligated to stop bleeding. Which organ is ruptured? Now the ligation of internal iliac artery is used to prevent pelvic hemorrhage, that is pelvic hemorrhage, and there is extravasation of urine. So which organ lies in the pelvis which has urine? Urinary bladder. In which other condition we do internal iliac artery ligation? Postpartum hemorrhage. The complication of postpartum hemorrhage when we ligate this internal iliac artery is bladder necrosis. Whenever a person is having hemorrhage, postpartum hemorrhage, and you ligate internal iliac artery, so what can be the complication? Bladder necrosis due to decreased blood supply to the bladder. Female at 34 having symphysis of fundal height of 28 weeks. The cause is, now if you see, this is small for gestation. The actual age was supposed to 34 and it is now 28. So this is renal agenesis. Why? Because in renal agenesis there is decreased urine. If there is decreased urine, there will be oligohydramnia. If there is oligohydramnia, the urine is not forming, there is oligohydramnia, so that gives you what? Decreased fundal height. Stratum functionalis includes stratum spongiosum plus stratum compactum. Regarding surfactant, that was the statement. So this is a poor recall. I would say this is poor recall. Okay, what is this ratio called? This is called LC ratio. LS ratio, lecithin to sphingomyelin ratio. If that is more than 2.5, this means maturity, lung maturity. It means this is normal. That is normal. There is decreased risk of respiratory distress syndrome. And surfactant production starts at 22 to 24 weeks. This is another MCQ. 22 to 24 weeks. And ratio, if more than 2.5, it means there is lung maturity. If it is less than 2.5 or less than 2, it means there is high probability of respiratory distress syndrome. Urinary bladder parasympathetic supply, this is pelvic narrow. Coming toward the diagram. Now this is their diagram. You see this is parasympathetic pelvic narrow and causes detrusor contractility. The sympathetic is carried by hypogastric nerve. Sympathetic hypogastric nerve. And the somatic pudendal nerve. Pudendal nerve. And the sacral maturation center is S2 to S4. And the hypogastric root value is T10 to L2. And upper in the brain, where is the center of maturation? Pons. So on this diagram you have corrected 5 to 6 MCQs. 5 to 6 MCQ. Coming back toward the real. Most common carcinogen. Now we do not know for which cancer they are asking about. For lung cancer, for breast cancer, for which cancer. So over here I would add another MCQ. What is the most common cancer in both the sexes that has high mortality? What is the most common cancer in both male and female worldwide? That is lung cancer. Lung cancer. What is the most common cancer in females alone? Breast cancer. What is the most common cancer in the males alone? Prostate cancer. What is the most common cancer in children? That is leukemia. Leukemia. What is the most common CNS tumor in children? Astrocytoma. Astrocytoma. What is the most malignant tumor in children? Medulloblastoma. So over here I do not know what is the right option. Follow the majority. Virus, they are most common carcinogen. So chlorine is not, that is the chloride, polyvinyl chloride. So we are left with the virus and we are left with the chemicals. So coming toward next, which tumor is malignant? Glioma. Meningioma is 90% benign. Heavy smoker has small nodule on vocal cord, most unlikely. Now the people were having an objection regarding this. So over here they are asking about most unlikely, and over there the least common was, so that is carcinoma. That is least likely or unlikely, and the most likely is hyperplasia. Most likely is hyperplasia. The right option over here is missing. This is a repetition of the same MCQ, but over there this thing was missing, most unlikely, and that was actually misprinting, that was given in the option. And over here in the option, the right option is missing, that is carcinoma. The most, if the question says the most likely, if the question says the most likely, not unlikely, most likely, then the answer is hyperplasia. Hyperplasia. Second most common is atrophy. Second most common is atrophy. Coming toward the next, loss of ankle jerk, already discussed. No need to waste time on this. Cells from the corona radiata, already discussed. Granulosa cells. Jaundice and pregnancy. The GGT, they are talking about obstructive jaundice actually, because other things are produced by placenta. So they are checking your knowledge regarding the placental production of hormone. Lateral wall of third ventricle is formed by medial two-thirds of thalamus, discussed in details. Diagnostic lab test for infection by Streptococcus beta hemolyticus. Now that is actually the swab culture. You take the swab and send it for culture. If that is missing, then the blood culture. Now if the question asks, if the question gave you a scenario, the patient was having infection 3 weeks back, and now you are checking for exposure, the answer is ASO titer, then not the culture. For the word exposure, ASO titer. For the word infection, culture. So over here culture. Fast, sharp pain, A delta. Fatty acid oxidation, already discussed. Right option. Remnant of vitelline duct, this is mecal diverticulum. And the remnant of allantois, that is urachus. Remnant of allantois, urachus, remnant of vitelline duct, Meckel's diverticulum. And Meckel's diverticulitis present with the sign and symptom like appendicitis. Coming next, so the most common site of ectopic pregnancy is fallopian tube, and in the fallopian tube most common site is isthmus of fallopian tube. In fallopian tube has how many parts? These are another MCQs. 4 parts. The smallest part is, the narrowest part is that is isthmus, and the longest part is ampulla. These are other MCQs. Ampulla. Isthmus is the narrowest part, ampulla is the longest part. Coming next, condition with increased ESR. Now if we add except, it may be, let's suppose, apply this probability, we do not know, because the chances of poor recall are high in these MCQs. These are recall. So if we add except, the answer is polycythemia. Out of the option, only the polycythemia decreases the ESR, all other increases. Regarding how ESR is increased with infection, anemia and pregnancy, There is separate video on my channel by the name of ESR and its clinical implication. You can watch from there. So over here the answer is polycythemia. But if that is missing, if the question says what is the most common cause of non-infectious increase in ESR? Non-infectious, non-inflammatory, that is anemia. Non-infectious, non-inflammatory, that is anemia. The next MCQ is, how would you confirm that increase in ESR is because of infection or inflammation or anemia? So in order to differentiate that whether it is increased by infection or inflammation or anemia, we do CRP. So in majority of the cases, if CRP is also raised, probability is this is inflammatory or inflammation. Coming next, genital tubercle discussed in detail. Clitoris, in the resting stage, the binding site tropomyosin, clear mesonephric duct functionally persistes. This is actually the seed. Formula is seed. It gave rise to seminiferous tubules. It gave rise to ejaculatory duct, and it gave rise to ductus deferens. So both are present over here. So probability is there may be except in the stem, and the answer may be Stenson duct. But you have to clear your concept, and then you focus in exam and choose the right answer. Over here, two answers are right: epididymis and ductus deferens. Most common cause of premature ovarian failure. Now this was the MCQ that was left in the previous lecture, and I talked that I will discuss later on. Now most common cause of premature ovarian failure. Now what is premature ovarian failure? That is menopause before 40 years of age. Simple definition: a patient is having menopause but the age is less than 40. This is premature ovarian failure. Most common cause is idiopathic on the top. If the answer is missing idiopathic, next is autoimmune. If the autoimmune profile is normal, next is chromosomal abnormalities. If the MCQ says the age is less than 30, what will you do? The answer is karyotyping. We have to exclude the chromosomal abnormalities. Like Turner syndrome, like Y mosaicism. So clear your concept regarding this. Less than 40, menopause, premature ovarian failure. Most common cause idiopathic. If not an option, autoimmune. If the age is less than 30, what specific investigation would you do? Karyotyping. Next, a pregnant lady, already discussed in the previous lecture, posterior fontanelle. Coming next, which cranial nerves are parasympathetic? So the answer is A. 3, 7, 9 and 10. Oculomotor nerve, that is for accommodation, the parasympathetic nerve supply. The 7 nerve, facial nerve, for lacrimation and salivation, the parasympathetic nerve. The glossopharyngeal nerve, the sensory and the parasympathetic supply to the glands. The 10th nerve, the sensory and parasympathetic supply to a lot of glands, and also the parasympathetic supply to the parotid and other salivary glands. Now I will here give another MCQ. Pure sensory nerve 1 to 8, exercise. Pure motor nerves 3, 4, 6, 11, 12. Mixed nerves, those nerves which are missing in these. The first one 1 to 8 is the pure sensory. These are the pure motor, and the mixed nerves, whatever are left, these are the mixed nerve. Most common complication of diabetes, dry gangrene. Medial quadrant of the breast, that is internal thoracic group of lymph nodes. Pleural vein, shoulder, that is splenic nerve. C3, C4, C5, phrenic nerve, shoulder. Epidural block, 3% chlorpromazine is more rapid than 2% lidocaine. Now the answer is pKa, already discussed in the previous scenario, and I have given the reference that onset of action depends upon the pKa. Toxoplasmosis is protozoa. If there is missing, then parasite. It is not helminth, because helminth are usually extracellular, and this is intracellular. Local anesthesia past placenta by now simple diffusion or passive diffusion, while glucose by facilitated diffusion. Gram-negative infection, urinary. Though the small bowel and the biliary tract, there are chances, but most common is urinary tract. Pyramidian approach. Coming toward this MCQ. In the pyramidian approach, which ligament is damaged or which ligament is pierced? That is ligamentum flavum. Pyramidian means you are going from the side. Median approach means you are inserting the needle in the midline. So if you are moving from the side, you are skipping two muscles, the the two ligament, the interspinous ligament and the supraspinous ligament. If you are inserting the needle from the side, these two muscles are skipped. But if you are moving from the midline, then you pass from the skin, subcutaneous tissue, then you pass through the supraspinous ligament, then the interspinous ligament, then the ligamentum flavum, and then into the epidural space, and then dura mater, and then subdural space, and then goes to inside toward the spinal canal or the subarachnoid space, then the arachnoid matter, and then the subarachnoid space. So the answer over here is C, ligamentum flavum, because these two are bypassed. Already discussed this. That is Bipasha Basu. Agglutination is second week. This is first week, second week, third week, and fourth week. This is agglutination. So this is seen in the second week, and the second week who are here, that is Vidal. In Neo, already discussed, that is L3 with reference. Sebaceous glands are absent in palms and soles, but the sweat glands are absent in glands of the penis, corner of the lips, and glands of the penis, and the labia minora, not the majora, labia minora. There are no sweat glands. Histopathology shows the pleomorphism, the retri, but I don't know how it is pronounced. Retriges, loss of polarity, and increased nucleus. The answer to this MCQ is verrucous carcinoma. Verrucous carcinoma. The answer A is the wrong option. Verrucous carcinoma is a variety of squamous cell carcinoma, a subtype of that. Right adrenal glands drain into the inferior vena cava, already discussed. Secondary cartilaginous are the midline, so the symphysis pubis and this one between the sternum and the manubrium. Cardiac surgeon doing open thoracic surgery, and most common injured vein is the great cardiac vein. Amniocentesis. Okay, this is the second MCQ that I talked at. In the previous lecture I skipped this MCQ, and I told you that I will explain in the next video. So over here, option D is wrong, rupture of placenta, because it is very early. Placenta is not yet developed. Option B is wrong because it is 1 in 200, not 1 in 2000. This is 1 in 200. In amniocentesis, the risk is 1 in 200. Now this is important for gynae people, you should note it. In chorionic venous sampling, the risk is chorionic venous sampling, the risk is high, that is 1 in 100. 1 in 100, the risk is high. So that is also wrong. 1% decrease in miscarriage, that is also wrong, because that is 0.5% decrease in miscarriage, that is wrong. So over here, that is the option B, 10% increase in the risk of fetal telopees. Why not? When there is leakage of amniotic fluid, you did the procedure amniocentesis and there is leakage of amniotic fluid, then the risk is 10 to 15%. But if there is no leakage of amniotic fluid, then the risk is 1%. So keep yourself clear. These figures should be clear, because in exam they can change the scenario. So with amniotic fluid leakage, the risk is 10 to 15%. Without amniotic fluid leakage, the risk is 1%. So coming next, pre-ganglionic discussed, acetylcholine also discussed, tuberculosis. Antibodies are found from plasma cells following combination, that is oxytocin, prolactin and cortisol. Langerhans giant cell found in which one of the muscle is stretched and leads to relaxation of muscle. Golgi tendon that inhibit muscle contraction. Lateral attachment of urogenital diaphragm. So coming next, that is ischial tuberosity and fumic rami, that is the right option. Coming next, already discussed type 3, the toxide that causes type 3. Right kidney is not related. Now this is a poor recall. You have to focus in exams on all the options. If you exclude the knot, then ascending colon is head guard association, but the descending and sigmoid are on the opposite side. Poor recall. Fastest control of BP is by baroreceptor. Least adaptable BP receptor or baroreceptor. Fastest BP control, baroreceptor. Fastest slowest adoption, slowest baroreceptor. Slowest BP receptor, slowest BP receptor adaptation, baroreceptor. While overall that are the pain receptor. Slowly adapting receptor are the receptor that do not adapt, that are the pain receptors. Over here, baroreceptor. Baroreceptor responds to increase in BP or decrease in BP. Another MCQ. The answer is none of these. This is the most wrongly explained MCQ in the group, because the right answer is missing. That is actually pulse pressure. That is not the systolic pressure, that is not diastolic pressure. And if we utilize that thing, increase in pressure and decrease in pressure, that will actually lead to the selection of wrong option in the exam. So that's why I am explaining each MCQ with bonus MCQ, and I am explaining with concept. This is actually the smart learning, how you should study the MCQ. So there is the pulse pressure. If that is not an option, then that is the change in pressure. Change in pressure. There must be one option out of these. So that is poor recall. Baroreceptor respond best to pulse pressure. If that is missing, then changing blood pressure. The changing blood pressure. And the fastest response is again the baroreceptor. Local anesthetic mechanism of action, block the sodium channel. A5, amniotic fluid index is less than 2. Probability renal agenesis, because there is no amniotic fluid, and because there is no urine, there is no fluid. Vulval premalignation is Paget disease. Most common, if asked about most common vulval lesion, then condyloma. Again, Paget disease. A woman with chest pain, worse on lying, already discussed. Chest pain, pericarditis. If asked about epigastric pain or abdominal pain that is worse on lying and relieved on the sitting, the answer is pancreatitis. And if if question asked about that the pain is aggravated with the coughing, then the answer is pleuritis. The secret regarding disease of patient. The answer D is the right answer. Should be breached if the patient authorized. If the patient gives you consent, then no problem. Again, rifampicin already discussed in detail, because it is enzyme inducer. So actually it quickly metabolizes the estrogen, it quickly metabolizes the OCP, and there is OCP's failure. So either increase the dose or use another form of contraception such as barrier method. Slide showing simple columnar epithelium with indistinct smooth muscle and cleft. Now focus on this simple columnar. Simple columnar, the uterine tube. The ovary have simple cuboidal. The cervix has both ecto and endocervix. So the endo has columnar and the ecto is having squamous, and the uterus have columnar. So over here the answer is right, uterine tube. Condition with increasing in ESR infection, but anemia can also cause. So if there is a word except, then polycythemia. If no word except, in the same scenario I will pick the infection. I will pick the infection. Dysarthria discussed in detail. Cerebellum. If aphasia or dysphasia, then cortex. Now 3% one drug and 2% another drug crosses placenta. This is due to lipid solubility. That is the right answer. But if say 3% of the same drug and 5% of the same drug, the 5% crosses placenta more as compared to 3%, then increase in concentration. But they have given you comparison. So the lipid solubility. A patient who is from middle class family and she has cervical dysplasia, the reason may be already discussed human papilloma virus, because in advanced countries, in developed countries, they have vaccinated. So this is the last page. I have already discussed this in very detail. After 48 hours starvation, energy source is, this is fats, triglycerides. The cause of death and gas gangrene discussed multiple times. Toxic shock, a female has presented with shock history of abortion. Uterine artery, a female presented with history of a car accident, already discussed in the same paper. Urinary bladder, parasympathetic reduces hard by. Now if the question says parasympathetic activation causes prolonged PR interval, where is the mechanism? The answer is AV nodal delay. It increases the AV nodal delay. It increases the AV nodal delay because the delay is increased, and it decreases the AV nodal conduction. There is another MCQ, they will confuse you. Decreases the AV nodal conduction and increases the AV nodal delay, but the heart rate is reduced due to decrease in the activity in the SA node, causing potassium efflux. ACTH effectively controls. The answer over here is cortisol. It is not hydrocortisone. Hydrocortisone is not produced in the body. That is cortisol. If that is missing, then the answer is adrenal androgens. Option B, not aldosterone. Aldosterone secretion is independent of ACTH, because in all those diseases in which the ACTH production from the brain is decreased, the aldosterone function is normal. So this is the clue that ACTH has no effect on the aldosterone. And there is another MCQ on that. A patient is having Addison disease, but his BP is normal. Where is the problem? Problem in the brain. Another MCQ, problem in the brain that causes decreased ACTH production. Another patient, a patient is having Addison disease, but BP is also low. Where is the problem? Then this is problem in the adrenal gland, because the aldosterone production from the adrenal gland is independent of ACTH. If there is any problem with any MCQ, you can ask me in the comment section. Or if there is any wrong with the MCQ, because I'm also a human being, and if you think that I'm picking wrong option, you can ask me in the comment section and we can have a discussion regarding that. Oxygen dissociation curve is shifted to the left when alkalosis. Alkalosis shift to the left, acidosis shift to the right. Shift to the left mean bonding between the hemoglobin and oxygen is high, so there is high affinity, so there is decreased release. Shifting of the curve toward the right mean bonding between the hemoglobin and oxygen is low, so there is release of oxygen easily. That is a statement. Compact bone is characterized by. Now over here both A and B are right. There are concentric lamellas, and there are lacunae having osteocytes. So you are having Haversian system in which there are blood vessel run. So both are the right option. So this is poor recall. The cause of death and gas gangrene already discussed. Sphincter urethrae is the content of deep perineal pouch. So with this paper is completed, and please like, subscribe my channel, and share my channel, share my links to these MCQs. And if there is any problem or you think it needs some improvement, you can give me a suggestion in the comment section below. Thank you for watching.